Is it live streaming? I can't see myself on YouTube. It is showing live stream ended at my end.
It's live, sir. I'm sharing the streaming.
Is the live stream on at your end? Hello. Yes. Am I audible and visible now? Please confirm. Question. Because I don't want to leave the last one, because whatever you believe will be the one which will be asked to you in the exam. Please tell me in the message in the comment box. Yes, okay. Thank you, Dr. Amit. चलो start करते हैं. Just a minute. Okay. So the last point about galactosemia, which I wanted to emphasize. Am I audible? Am I audible and visible? Please confirm. Yes. So some of you are still staying around. You have not left it. Great, great. So before it goes away again, let us try to finish off the topic. So as I was talking about galactosemia, so these points I have already covered. Later on, when you see on the YouTube, all these segments we will join together. So you will have a one continuous video for you, right? So the last point which I want to emphasize is uh, in galactosemia, the new thing which is mentioned in most textbooks, including Nelson, is that although galactosemia can have varied presentation in newborn period, but many of them will survive the newborn period and even in fancy. There are cases where they can go into adulthood also, but females who survive into adulthood, virtually all of them tend to develop pubertal problems and infertility. So infertility in female survivors of galactosemia is very, very high. The reason for this is not entirely clear, right? This is the new thing which has been mentioned. It was new for me also. It was not there. Yeah, I did not know about it. It is a latest research and follow-up which has been added in multiple textbooks, right? Let us move towards clinical scenario question number 7. So clinical scenario question number 7 says, read it carefully. You know the answer, but read it carefully. Female child aged 3 months was evaluated for multiple episodes of hypoglycemic seizures. On examination, she was found to have hepatomegaly without splenomegaly. There was enlarged mean renal diameter on ultrasound KUB. Renomegaly किसमें थी? याद करो. Blood investigation revealed lactic acidosis, hyperuricemia, and hypercholesterolemia. This child is likely to have least risk, least word ko miss out nahi karna hai, of which complication. The first step here is making the diagnosis. What are the clues? Inborn error of metabolism hai, liver involvement hai, hypoglycemia hai, kidney involvement hai, kidney bada ho gaya hai, but no splenic involvement. This is classically seen in type 1 glycogen storage disorder, also called as von Gierke's disease. Type 1 glycogen storage disorder, also called as von Gierke's disease, right? In type 1 glycogen storage disorder, there is deficiency of the enzyme which is responsible for conversion of glycogen into glucose, and because of this, the child suffers from hypoglycemia. However, the liver and other organ systems may be studied with glycogen, right? Glucose 6-phosphatase is the deficient enzyme in vast majority of these patients. Now, this question is asking about the complications of glycogen storage disorder. Remember that what does the various textbooks say? More than 90%, they continue to have proteinuria. They continue to have, what are the complications that you need to remember? They continue to have proteinuria in later life also, right? Secondly, about 10 to 30% patients will develop hepatic adenomas. And many of these hepatic adenomas can later turn into carcinomas. So hepatic malignancies can also develop. AFP and CEA detection is not very accurate in these patients, unfortunately. So, but still we need to follow up and look for these hepatic adenomas. Again, it is found that about 50% has also been described, although there is cardiomyopathy is not seen. Why? Cardiomyopathy is a feature of which glycogen storage disorder? It is not seen in GSD, either in acute stage or as a complication. It is not seen in GSD1, but a feature of GSD2, which is nothing but Pompe's disease. Pompe's disease. Pompe's disease, right? And that is why cardiomyopathy is the likely answer. The question is saying which of the following has least risk of complication. Additionally, you should remember these children are prone to get pancreatitis. They are prone to get atherosclerosis, and they are prone to get gout in later life. Some of them, about 5% patients, can develop pulmonary hypertension in later life as well. We all read about glycogen storage disorder, but more and more children are surviving these days. And if they are surviving, complications and their management becomes important. And this is the new trending thing related to von Gierke's disease that additionally you should know. Before we finish off the session, have a look at this glycogen storage disorder classification. So type 1 is von Gierke's disease. 1A is due to glucose 6-phosphatase deficiency. 1B is a rare form where there is translocase deficiency. Organ involvement, liver and kidney. Spleen is not involved, and type of glycogen is increased. It is increased in amount, normal in structure. Type 2 is Pompe's disease. Alpha-1,4-glucosidase, also called as acid maltase, has been asked in INI-CET, FMG multiple times. All organs are involved, especially cardiac involvement. So cardiac involvement is a hallmark feature of which disease? GSD type 2 disease. Thirdly, we have type 3 disease, Cory's disease, Forbes disease, or limit stenosis, where debranching enzyme or alpha-6-glucosidase is deficient. Here, the glycogen is increased, but there are short outer branches. Fourth is Anderson's disease or amylopectinosis, where branching enzyme is deficient, also called as alpha-1,4-glucan. Here, a normal amount is there, but very long outer branches of glycogen are found. Type 5 is McArdle's disease, which is muscle phosphorylase, and they predominantly present with fatigue-related symptoms. Then we have Hirsch's disease, where liver involvement is there. We have type 7, which is Tharouy's disease, which is due to phosphofructokinase deficiency, and it involves the RBCs as well. Then we have type 8 and 9, which are due to phosphorylase kinase deficiency. We have type 11, which is Fanconi-Bickel syndrome, which occurs due to GLUT2 deficiency. So they can ask in exam, which glycogen storage disorder ke andar GLUT2 enzyme is deficient? It is Fanconi-Bickel syndrome. It is a very rare type of glycogen storage disorder. You all have multiple mnemonics, I know. All of you are very fond of mnemonics. You can follow your own mnemonics. I used to follow in my time my own mnemonic. Very pretty Catherine. Very pretty Catherine. After marriage, hates Tarun. You can replace this Tarun with some other name. You can replace this Catherine with some other name. I use these names because they are safe. They are safe names. So very pretty Catherine, after marriage hates Tarun. Von Gierke's disease, Pompe's disease, Cory's disease, Anderson disease, McArdle disease, Hirsch's disease, and Tharouy's disease. So this is one mnemonic from my side as well, in case you are not using any mnemonic here. And then lastly, if they tell you inborn error of metabolism, where there is a cute looking chubby face like a doll, this is the one which is seen in glycogen storage disorder type 1. This is the doll-like face. When we say doll-like face, they have chubby cheek, rounded face, fat deposition, short stature, and these are the kind of kids you would like holding their cheek and doing like that. But these kids are going to have a lot of problems. They're suffering. So see, doll-like face. In a non-medical way, you say doll-like face, you are praising someone. In medical world, you'd say doll-like face, you are denoting a disease. So the context determines whether you are praising someone or you are talking about suffering of a patient. So doll-like face, classic feature of von Gierke's disease. And in the end, I would like to summarize, when it comes to success, there are no shortcuts. All of you who are appearing in FMG exam a few weeks from now, please revise whatever you have read so far. No new things right now. All of those who will be targeting the exam and have 6 months or more than 6 months, final year students, pre-final year students in MBBS, my advice to you is, do not take shortcuts. Shortcuts work for short duration. They work for short period of time for a short circle of people. Long-term game agar khelna hai, if you want to have a good success rate, it is always better to build concepts close to the exam, go for the shortcuts. Do not, there is no substitute to hard work, detailed reading, and next one exam is not going to be easy. Again, I reiterate, at DocTutorials, we are coming out with something very, very special for all of you. So stay tuned, and I do hope all of you will benefit from this metabolic disorder discussion. Thank you so much. And this is Dr. Sandeep. Please share in case you have any doubts in the comment section. Thank you.